the biggest myths we have here. Right? People with mental health issues are dangerous and they're often violent. Alright? Happens a lot. Mainly we see the news, we see what's happening with people on the news. They say, you know, so-and-so with mental health issues was violent towards police, they had to be tased, shot, whatever. We see it in movies a lot. I really like Batman, however, all the baddies have mental health issues. Alright? I once actually heard a joke about Batman. He was a rich white guy running around beating up the mentally ill. Okay?
He's mentally ill.
I'm not a doctor, I don't know. I'm not a doctor. Okay? But when we see those messages in the media, that's where this myth comes from. That's what perpetrates that myth. And so then when we see someone in the street pacing up and down, yelling at no one, yelling at everyone, that's when we think, oh, he's dangerous, I need to stay away from him, he's mentally ill. The truth is, mental health clients are more likely to be victims of assault. A lot of clients I've worked with, part of their experience is they have been bashed in the public. And so it makes you wonder, why does he isolate himself? Well, every time he goes out, people identify him as mentally ill, they bash him. Okay? Small percentage of clients are actually violent. All right? People with mental health issues are going to suicide. Suicide is a big risk with mental health. However, not everyone who is mentally ill is going to suicide. It's just the same as not everyone who thinks about suicide is mentally ill, which is something I've also heard a lot. When you do hear there's mental illness in the call, yes, we need to be vigilant about suicide. But we don't need to think this is what's going to happen, this is what it's all about. Another big myth is that people with mental health issues must be on medication. When I talk about medication a lot tonight, there's going to be a number of different sides coming into it. Fact is, yes, medication does help a lot with mental health issues. Is that the only treatment available? No, it's not. You know, in Finland, they're actually doing a lot of really interesting things with mental health clients who are not on medication. They're using a lot of different therapies other than medication, and it's bringing really good results. This is not saying that everyone who calls, especially if they don't want to take the medication, you know, we encourage where you don't have to. There's lots of different issues there. But medication is not the only answer. It's not the be-all and end-all, despite what doctors or other professionals will say. And also, another issue is that people with mental health issues need to be locked up. You know, again, hospital does play a part in recovery, but prolonged hospitalizations can be detrimental. We've seen clients who come into the system out of hospital completely dependent on the system, completely dependent on their doctors to tell them what to do, when to do it. So they come out into the community and they don't know what to do. They actually lose their social skills. Even if they had them before, they lose them over time. And so a lot of our work was to try and help clients in the community before they went to hospital, try and solve whatever was going on before they needed that. That way they can build up their resilience. They can build up their unique strengths. If they can do that enough, their need for hospitalisation is going to reduce. Then that's also going to have an effect on the system. Not so much demand on the system, has a dominoes effect and actually works out better for the wider community.